Hi, my name's Chris Theokli. I'm a consultant ear, nose and throat surgeon who works here at the One Ashford Hospital. I've been involved in ENT surgery for almost 15 years and I'm a consultant at the East Kent Trust. Globus is the term we give to the sensation of feeling a lump in the throat. Now, it doesn't necessarily mean that there's an actual lump there. It's the sensation that patients feel and come to us understandably concerned with that particular symptom. So the main symptoms of Globus is the sensation of a lump in the throat. But patients often talk about a sense of pressure or tightness within the throat itself. And sometimes they say that there's mucus accumulation within the throat, they just can't clear. And often you'll see patients who try and throat clear, but nothing ever comes up. In addition, there's a lot of stress and anxiety associated with this particular symptom, because it's a really stressful situation for a patient to go through. And so they get the sense that their throat actually closes up and spasms. This also is a really common symptom. Because of these stresses, patients' voices change as well, and over time they become hoarse, especially when they talk for long periods of time. All of these symptoms together can add to what is already an extremely stressful and anxious period for them. So the main cause of Globus is actually acid reflux. So acid is produced in the stomach and it travels up the esophagus, which is the food pipe, and it can overspill within the throat itself. When that occurs, it causes irritation and inflammation, leading to a sensation that there is a lump there when in fact there isn't, and all you're seeing is actually the effects of the inflammation. This is really common, and we see that in the vast majority of people who have Globus symptoms. But this isn't the only cause for Globus. Globus has lots of multiple causes. Postnasal drip, where mucus drips down the back of the nose to the throat, can also irritate and cause the sensation. In addition, a low-lying, low-grade infection such as Candida, which is thrush, can occur. And this is extremely easy to treat, but obviously has to be recognised and identified before it is able to be treated. Sometimes there is no cause for Globus, and a lot of patients are just reassured by the fact that when we examine them, we don't find a sinister cause for their symptoms, which is obviously one of the biggest worries that patients have when they come to see me. If patients have symptoms of Globus, then they need to be seen by an ear, nose and throat consultant such as myself. We take a full, careful history and we perform a thorough clinical examination. The way we perform this is by performing something called a flexible nasal endoscopic examination. This is a small camera test which is passed into the nose and hovers at the back of the throat. It then allows us to look down and visualise all of the throat, and we can say with confidence what's occurring and come to a diagnosis. People often worry about having this procedure performed, but it's really straightforward. Often local anaesthetics not even required. It's performed as part of the outpatient consultation. And at worst, people often say that there's a little tear to their eye or a sense of uncomfortableness as it passes through the nose. But it's generally very well tolerated and takes less than a minute to perform. So the main treatment for Globus is to actually identify the cause. And as mentioned, sometimes just by having the investigations and knowing there's nothing sinister can be reassurance enough for the patient. If we do find evidence of an abnormality that can cause Globus, then we will obviously treat it at the time. If we see evidence of acid reflux, we will prescribe antacid reflux medication. Similarly, if we see evidence of postnasal drip, then we will address this by preparing and prescribing nasal preparations for the patient. Also, if we see evidence of infection, we will treat that at the same time. Sometimes just by having the reassurance is all that is required for patients to be confident that there is nothing more sinister occurring. And lifestyle modification advice, such as cutting down on caffeine, cutting down on alcohol, avoid eating late at night, can be really beneficial for the patient and can go a long way to treating the symptoms themselves. If patients are concerned with regards to Globus and have a sensation of a lump in the throat or any of the symptoms I've described, then they can come and see me here at the One Ashford for a full history and thorough clinical examination. I hope by doing this they will get the reassurance and maybe even the diagnosis and treatment that will help them improve their symptoms.